wait is too long in the Accident and Emergency Department at the QEH. That observation from Chief Executive Officer Neil Clark early in his tenure. He tells CBC the hospital does need some developments, but it has a good team and better can be done. Mr. Clark says the A&E is one of those areas needing improvement.
I know that the A&E waiting times are causing a lot of pain, and rightfully so. Nobody should be waiting in A&E any longer than what they need to be. You're in pain and you're afraid and you don't know what's going on, or your family members in pain and afraid and you're worried for them. So nobody should be in the A&E department any longer than they need to be. So we need to do something about the waits in the A&E department. But that's a whole system problem. And that's about me working with the Ministry of Health and Wellness and the polyclinics and the private sector and everybody else about why are people presenting at the A&E department? What are the alternatives? And what can we do even to stop them becoming ill in the first place?
He says they're working with partners such as the polyclinics and Ministry of Health to help people better understand if their condition is indeed an emergency or not. According to him, a Choose Well campaign could help.
They're going to where they think's the right place. There's no doubt about that. They think they need help and they're coming here for that help. I guess it's how we educate them that there's help available in other places. Choose Well campaigns. You know, maybe the pharmacy could have helped you. Maybe a phone call could have helped you. Maybe the polyclinic could have helped you.
Mr. Clark says he's looked at what can be done to help the department.
There are things we can still do internally. I've had a look at the A&E department and how it functions. There are things that we can do to improve the patient flow through that department and to further improve how we escalate and manage when it gets busy. There will be times when there's a spike of attendances coming in, which for the next 4, 5 or 6 hours we've got to put extra resource in to manage that. We can be more responsive and do that. It's also my role here to work out how the different departments in the hospital support the A&E department, both in general regular times and in points of escalation, pathology, radiology, inpatient beds.
He also believes there's some areas which are unsatisfactory.
Patients waiting in A&E 2 days, patients not moving up onto the wards when there's a bed available because of the time. That's not acceptable. So I'll be working, and we've already started some work with the wards, the medical wards, about how we can get better patient flow through the wards.